What if 2 cloves a day was doing more for your body than most supplements you're spending money on? This video is going to show you exactly what changes inside your body when you make this one small daily habit. And some of these changes you'll actually feel. Here's what we're going to cover. First, the physical changes, the ones you'd notice yourself over days, weeks, and months of doing this consistently. Then the biology behind why eating whole cloves is different from anything else in your spice rack. And at the end, exactly how to eat them. Because there's a right way and a wrong way, and if you're doing it wrong, you're leaving most of the benefit on the table. 2 cloves, every day. Let's get into what that actually does to your body. Most people over 50 aren't sick. They're just running at 60%. They get through the day, they function. But somewhere along the way, the things that used to come easily got harder. Staying sharp after lunch, having energy left at 7 in the evening, waking up and actually feeling ready instead of just functional. The adjustment happens so gradually that most people don't notice it's happened. They've just quietly rearranged their life around the lower energy. They stopped making the Saturday plans they used to look forward to. They watch their grandkids tear around the backyard and stay in the chair instead of joining them. Not because they can't, technically, but because the energy to engage just isn't there the way it used to be. And eventually, they stop noticing what's missing. I've seen this happen to people who were active, capable, and had every intention of staying that way. Almost none of them connected it to anything fixable. They assumed it was just what this decade feels like. A significant part of it isn't. Chronic oxidative stress, chronic low-grade inflammation, and blood sugar that swings wider than it should, those are 3 of the most common silent drivers of that kind of slow drain. Documented, measurable, and directly addressable. That's what this habit is about. The first change you'd notice, within the first minute. Chew a whole clove and something happens almost immediately, a warmth, then a mild numbing sensation that spreads across your gums and the sides of your tongue. Most people's first reaction is to wonder if they did something wrong. They didn't. That's eugenol at work. Eugenol is the primary active compound in cloves. It makes up between 70 and 90% of clove essential oil. What you're feeling is it binding to the same receptors dentists exploit when they use clove-based dental cements to numb tissue before procedures. This isn't a vague wellness claim. It's the same biological mechanism. You're feeling it from the inside. That immediate sensory feedback matters. It's one of the clearest signs that what you're eating is biologically active in your body right now. Not in 6 weeks, not after a blood test, right now. The second change, something you'd notice the same day. Within minutes of chewing a clove, the bacteria responsible for bad breath are being killed on contact. Eugenol has broad-spectrum antibacterial properties, documented thoroughly enough that it's used in commercial mouthwashes, dental cements, and oral antiseptics around the world. Fresher breath isn't a trivial benefit. For a lot of people, it's an immediate, motivating sign that something is working, which matters for building any consistent daily habit. And here's the biology behind why eating cloves delivers something different than drinking clove water. When you steep cloves in water, some eugenol and some polyphenols transfer into the liquid, but eugenol is only slightly water-soluble. A meaningful portion stays in the clove. When you eat the clove, chew it, and swallow, you get direct contact between those compounds and your oral tissues, your esophagus, and your gut lining, in addition to whatever gets absorbed into the bloodstream. Higher concentration, more direct delivery, and when consumed with a small amount of healthy fat, which eugenol is fat-soluble, the absorption increases further. 2 whole cloves sits right at the threshold the World Health Organization considers safe for daily consumption based on eugenol content, enough to produce real effects. Not so much that you're pushing into territory where the liver has to work harder than it should. Now, what else does it do? The third change, something you'd notice within a few days. Your digestion gets easier. Eugenol stimulates the secretion of digestive enzymes, the proteins your gut uses to break food down. At the same time, it relaxes the smooth muscle lining of your GI tract, which reduces the cramping and gas buildup that causes bloating after meals. For someone over 50, this is particularly relevant. Enzyme production naturally slows with age. The gut becomes less efficient. Things that digested cleanly at 30 now sit longer, ferment more, and cause discomfort that most people chalk up to just how their stomach is now. A lot of the time it isn't. It's a digestive system that needs support it isn't getting. 2 cloves a day, chewed and swallowed with food, puts those compounds in direct contact with your gut lining at the exact moment they're most useful. Within a few days of consistency, most people notice the difference. Less heaviness after meals, less gas in the evening, a digestive process that moves more smoothly. It's a small change, but it's one of the first ones you'd actually feel. The fourth change. This one builds over weeks, but when it arrives, you notice it. The morning stiffness starts to ease. Eugenol blocks two of the main pathways your body uses to trigger inflammation, including the same enzyme that ibuprofen and naproxen target. Those medications work by blocking it. Eugenol does something similar, through a different mechanism, without the GI irritation that comes from long-term anti-inflammatory drug use. This doesn't mean cloves replace medication. If your doctor has prescribed something for joint pain or inflammation, that conversation stays between you and your doctor. What it does mean is that consistently putting anti-inflammatory compounds into your body every day, through food, not a pill, changes the baseline. The chronic, low-level inflammatory load that accumulates over decades slowly gets lower. You wake up and your hands feel a little more cooperative. Your knees take less convincing. That first hour of the morning that used to feel like warming up a stiff engine becomes shorter. Not because something miraculous happened, because your body's inflammatory environment shifted, quietly, over 30 days. That's what consistent use looks like. The fifth change. This one connects directly back to why most people over 50 feel like they're running at 60%. Blood sugar instability. Most people don't associate low energy with blood sugar. They associate it with sleep, or stress, or just age. But the afternoon crash, the brain fog that sets in around 2 or 3 o'clock, the feeling of needing caffeine or sugar to push through the second half of the day, those are the fingerprints of blood glucose that's swinging too wide. This is where cloves become genuinely interesting. In a 2019 study published in BMC Complementary and Alternative Medicine, researchers gave participants a polyphenol-rich clove extract once daily for 30 days. Post-meal blood sugar dropped by 21.5% in healthy adults. In people with prediabetes, it dropped by 27.2%. The mechanism: the polyphenols in cloves slow the breakdown of carbohydrates in the gut and support the liver's management of glucose production. Eating 2 whole cloves daily puts those same polyphenols into your system, in direct contact with your digestive tract where that carbohydrate slowing effect happens first. More stable blood sugar means more stable energy, fewer crashes, more of the afternoon that used to disappear. That 60% feeling, a meaningful part of it is this. And it's one of the most correctable things on this list. The sixth change. This one builds quietly over weeks, in your mouth. The antibacterial effect you felt on day 1 was eugenol working in real time. But the longer-term story in your mouth is different and more significant. Bacteria in the mouth don't just cause bad breath. Over years, they produce acids that erode enamel, inflame gum tissue, and create the conditions for infection. For someone over 50, this process has been running for decades. Gum recession, sensitivity to hot and cold, teeth that feel less secure than they used to. Most people assume this is just aging. A lot of it is bacterial damage that compounds slowly, year after year. Research published in the International Journal of Dentistry found that clove may help limit tooth enamel loss and can work alongside fluoride to protect against root decay. The antibacterial compounds you're introducing daily start shifting the bacterial balance in your mouth, reducing the harmful bacteria responsible for plaque and gum disease, not overnight, but over weeks, consistently. Gums that bleed a little less when you brush, sensitivity that starts to calm down. Enamel doesn't grow back. Gum tissue doesn't regenerate once it's gone. The best thing you can do for your dental health at 55 is change the environment now. The seventh change. This is the one most people have never heard of, and it might be the most important mineral benefit on this list. Manganese. You know calcium. You know vitamin D. But manganese? Most people have given it no thought at all, and most people are getting far less of it than they should be. It does 2 specific things worth knowing about. The first is bone resilience, not the calcium hardens bone part, but the part that gives bone its ability to absorb impact without fracturing. Manganese is required for the structural proteins that keep bone from being brittle. Calcium makes bone dense. Manganese makes it strong enough to flex rather than crack. The second connects directly back to the energy conversation we started with. Manganese is the essential ingredient in your body's primary antioxidant enzyme, the one that neutralizes one of the most destructive free radicals produced during normal cell metabolism. Without adequate manganese, that enzyme can't do its job. Free radical damage builds, cellular fatigue compounds, and you feel it as that persistent, low-level exhaustion that no amount of sleep seems to fix. 1 teaspoon of ground cloves delivers over 55% of your recommended daily manganese intake. 2 whole cloves every day provides a meaningful, consistent contribution to both bone integrity and that antioxidant enzyme system, in a form your body absorbs well from food. That's not supplementation. That's just eating one of the most nutrient-dense things in your spice rack. The 8th change. You won't feel this one, but it matters. Your liver is processing everything. Every medication, every inflammatory compound your immune system produces, every metabolic byproduct of every meal you've eaten for decades. And as we get older, that processing becomes less efficient, particularly when the liver has been dealing with years of accumulated metabolic stress, even the ordinary kind. The research on eugenol and liver health is primarily animal-based, so that's worth stating clearly. But what it consistently demonstrates is that eugenol reduces oxidative damage in liver tissue and supports the antioxidant enzyme systems that protect liver cells. The same compounds protecting your joints and your blood vessels are protecting your liver too. You won't feel this one directly. The liver rarely signals distress until the problem is significant. What you're doing is building a daily habit that quietly reduces the oxidative load on an organ that never gets a day off. That's worth doing, even if you never notice it working. The 9th change. Your gut's bacterial environment shifts. Roughly 44% of the global population carries H. pylori, a bacterium that lives in the stomach lining, drives inflammation, causes ulcers, and over time significantly raises the risk of gastric cancer. Most people carrying it have no idea. It causes no obvious symptoms for years. Eugenol has been tested directly against H. pylori in multiple studies. Research published in the journal Nutrients by scientists at Yonsei University found that a compound from clove extract reduced H. pylori bacterial burden in infected animals at cure rates up to 70%, depending on dose and duration. A separate study in MDPI molecules showed that clove essential oil inhibited H. pylori growth, including antibiotic-resistant strains, at levels comparable to amoxicillin. And here's the part most people miss. H. pylori did not develop resistance to eugenol even after 10 consecutive passages at sub-inhibitory concentrations. The bacteria couldn't adapt to it the way they adapt to antibiotics. 2 whole cloves a day means those antibacterial compounds are passing through your stomach lining every single day. That's not treatment, but it's consistent, low-level protection against one of the most widespread and underdiagnosed bacterial threats in the gut. The 10th change. The one that makes everything else work. Consistency. None of the changes on this list happen from eating cloves twice and forgetting. They happen from 2 cloves every day over weeks and months. That's not a complicated habit. It takes less than 30 seconds. It costs almost nothing, but it has to actually happen every day for the compounding to start. Pay attention to what you notice over the first 30 days. The digestion shift usually comes first, then the energy steadying, then the mornings getting easier. The changes don't announce themselves. They just quietly accumulate. The same way the damage that made them necessary accumulated, but in the other direction. How to actually eat 2 cloves and what not to do. The right way depends on your preference. All of these work. Chew them whole, then swallow. This is the most direct delivery. The chewing releases the oils make direct contact with your oral tissue, and then everything gets swallowed and absorbed through the gut. The numbing sensation is strongest this way. Some people prefer it, some find it too intense. Swallow them whole with food or a full glass of water. Less intense, still effective. The cloves get broken down in the stomach, and the compounds absorb from there. Grind them into food. Add ground cloves to oatmeal, a smoothie, a curry, anything warm. You lose the direct oral contact, but you keep everything else. What not to do? Don't use clove essential oil internally. It's too concentrated and can cause serious harm to the GI tract and liver at even small doses. Don't eat more than 2 or 3 whole cloves daily under the assumption that more is better. At high doses, eugenol becomes a liver stressor rather than a liver protector. The dose matters. One note on safety. If you're on blood-thinning medication, warfarin, aspirin, anything in that category, talk to your doctor first. Eugenol has a mild blood-thinning effect. Same goes for anyone on medication the liver processes heavily. 2 cloves. That's it. Start tomorrow. Pick whichever method you'll actually do consistently. Chew them, swallow them whole, grind them into your morning meal. Do it every day. Pay attention to how you feel at 30 days. Your body keeps score even when you're not watching. 2 cloves a day is one of the smallest things you can do that actually shows up in the score. If this was useful, hit subscribe. New video every week.